All right, this is our sterile dressing change demonstration. So first off for this, we're going to come in and do our beginning procedures. We're going to check our physician's order, note the time that we are to do this, any specific solutions that we would need to do for this. So we're going to gather our supplies, come to our patient's room, provide privacy for our patient, identify ourselves. So I'd say, hey, I'm Joy, I'm your nurse for today. Can you tell me your name and date of birth? And I would check her armband, and it says that she is Alice Wonderland, 2/22 of 2003. So verify that I have the right patient. I'm going to explain to her what I'm going to do, explain to her that I'm here to change her dressing. With this, we'd want to make sure that we had pain medication on board at least a half hour beforehand, so this is going to be not as painful, because again, like I said, this is an open wound for them, and it can be painful, so we want to make sure that we have pain medication on board. Also would want to assess any allergies. Is she allergic to any type of tape? So all of these things that we are going to take into consideration beforehand. So I'm going to expose just the area that we are concerned of here with her wound, trying to keep her covered up as much as possible. So just with me examining here with her dressing, I can see that she's got some strike through here on her dressing of some type of drainage. So like I said, so our first part of this is we are going to remove this old dressing, and for that I just would need to put on regular gloves. I would perform my hand hygiene, of course, coming in. I didn't talk about that at first, but I'm gonna clean my hands up nice and good. Usually, like I said, you're gonna do this as you walk into your patient's room so they can see that you've cleaned your hands. And again, hands with hand sanitizer on them don't work so well with gloves, but we'll make it do. Maybe. Okay, so the proper way to remove a dressing is we want to put, with our non-dominant hand, we want to put pressure on the wound, and not a lot of pressure on the wound, because obviously there's a wound under there. We don't want to cause them too much pain, but we want to kind of stabilize that. And then again, we're going to just kind of pull the tape back towards the dressing. If the patient's really hairy, we want to make sure that we're going in the direction of the hair, like so. Make sure that we're pulling up all that tape and getting the dressing free from the patient. So once we have all the tape clear, we want to kind of pinch up that dressing, and we want to hold it away from the patient so that they're not being able to see all of this dressing. We don't want to be freaking them out by the drainage that may be present, but we want to assess this in layers. So again, with our taco that we talked about, so the taco, the type, the amount, the color, and odor, if there's any odor present, is what we're going to observe here. And so like I said, so there's quite a bit of drainage on our ABD pad. And again, I can come here and just pull off these 4x4s that have been placed on top. And then again, if I had tweezers, which I don't, but anyway, I could come here and just pull out the gauze that is actually in the wound. So again, assessing, making sure, document in my brain anyway, the type of dressing, the amount, all of those fun characteristics, but again, at the same time, trying to keep it away from the patient. If they ask to see it, we could show them, but most likely we don't want them to see it. So when I'm done with that, I'm going to encase this all within one glove, and then again, turning that inside in second glove. So that icky dressing is now encased in 2 gloves, and throw that in a biohazard bag. So from there, I'm going to come here and I'm going to inspect my wound. I'm going to be looking for any signs and symptoms of an infection. The drainage, is there any purulent drainage? Again, odor that's coming from the wound. How's the peri skin area, the skin that's around the wound? How does it look? Is it looking like there's any signs or symptoms of an infection there? Is it remaining intact? And This looks okay. There's a little bit of redness, but not too bad. So anyway, so now I can come over here and I'm going to get my kit set up, my sterile kit. And again, this is a sterile procedure. So again, making sure that we are using our sterile technique with doing this. And so our kit here, I'm going to open the kit, and this one's been used and repackaged, so we're going to pretend like I'm peeling this away from here. I am going to put my drape down first, because I'm also going to put on my drape. I have a ruler here, sterile ruler, and some sterile applicators that I want to put on my kit before I actually put my sterile gloves on. So here I'm going to grab my drape, and this drape is wet, so we would not normally use this wet drape, but this one is wet. So I'm going to put my sterile drape down like so. And then from here, like I said, I can open up my sterile cotton tip applicators and toss them maybe on my sterile field without touching them or reaching over. Of course, they don't want to cooperate. There we go. And then, like I said, there's this sterile measuring device also. So, okay, so from there I can put my sterile gloves on and open up my sterile field. Get rid of that. All right, so here's, like, I now have my sterile drape, and like I said, then I can unload everything that's in my kit. So in my kit, I have a bottle of NS that is sterile. I have some tape. I have this measuring device that also comes with the kit that is good if we have, you know, wounds that are more a circular shape. It comes with 4x4s, a roll of gauze, a biohazard bag that we can put down here at the foot of the bed that we can throw our cleaning material in as we clean. And then it also comes with a ABD pad, which we're going to put on at the end. There's scissors and label. So first off, I'm going to open my bottle of sterile water, again keeping this away from my sterile field because I do not want to splash on it, because then it would not be sterile. There we go. Pry that off. And I'm just going to pour it here in this container here, and I'm going to move this over here slightly closer. So first off, I'm going to measure my wound. So like I said, so I have this dandy little ruler here, and then we want to make sure that we're using the same measurement. You know, if it's measured in centimeters or inches, we want to make sure that we're using the same type of measurement. So here, again, not actually touching it to the patient, I'm just going to hold it above that wound, and this looks like it's 14 centimeters. And then I can come here again, and the width again at the widest part is maybe 2.5 centimeters. So to measure the depth, this is where our Q-tips come in handy. We again, at the deepest part of that, we can set our Q-tip in there, and then again bring our fingers down to approximately the skin level, and again measure that. So again, that's about 2 centimeters deep. So again, make note of these measurements. If somebody's in the room with you, you can have them note the measurements, those 3 measurements. So now that I've assessed it, I've got my measurement, I'm now going to clean the the wound. So if this, I'm going to come over here with my 4x4s, and I'm just going to dip them in my NS. And again, kind of rinse that 4x4 out. So avoid my sterile field. And I'm going to come here and I'm just going to wipe. You can see there's a little bit of drainage on that peri-wound skin. So again, here starting at the edge of my wound, the cleanest area, I'm going to wipe out like so. You can use a different part of the gauze or come back over and get more gauze, and again, they could throw that away. Make sure we have enough gauze. Again, just that, making sure we're just cleaning that skin really well around the wound. We don't want that skin to break down and cause further, not trying to reach over my wound either, any breakdown. So from here, like I said, we've got it cleaned, measured, we've assessed it. So now we're going to do a little what they call moist to dry packing of the wound. So with that, we're going to use our 4x4s, but it's best if you can open up your 4x4s out all the way like so. And again, put them in our sterile water. And again, rinse it out. So again, I've dripped on there. Our Q-tips can come in handy with this, because this is going to help pack this into the wound. And if you use the stick end of your Q-tip, you can get that into the wound, up into those little corners. So again, can we get another one? Wet. Coming around that sterile field. And again, starting here at the other end and inserting that gauze into the wound. I probably would maybe want a little bit more. In fact, I guess I could come here. We've got this gauze here that we can use with our scissors and cut some more of that if needed. And the purpose of this is, like I said, the wet to dry is we put it in wet, and then as it dries, it's going to absorb the drainage or any dead tissue that is in the wound, so that when that's pulled out, that's going to pull that all out with it. We do not want this wet dressing on the skin around the wound, because again, that could break down the skin if it's left moist for that long. So we want to make sure that it is all tucked down inside of the wound like so. So usually I'd have a 4x4 to put over the top of it, but like I said, I didn't have all of my 8 4x4s because I reused the kit. So I am going to, just for the sake of covering that, I will cut a piece of this gauze like so and put over the top of the wound. Again, being careful not to touch the wound. And then from there, I'm going to get my ABD pad, and again, try not to touch the surface of that is going to be next to our patient, and kind of just pinch that up and place it over the wound. And at this point, the sterile part of this is kind of done. I don't like using tape with my gloves, so at this point I will take my gloves off, because I think tape and gloves do not go well together. So remove my gloves, and then again with my tape, make sure I'm securing the 4 edges of the dressing. Again, we'd want to check to see if our patient was allergic to tape. And then I have my little label that I can date an initial this as to when this dressing was changed, and I would peel that off and apply it to the dressing. So I would clean up all of my supplies, dispose of them, return the patient to a position of comfort. Again, reassess their pain. You know, I'd be monitoring that during the whole procedure, making sure that they were in a lot of pain. If they were in pain, I could have taken a timeout and said, okay, you know, we'll let you rest for a bit before we continue on with this. But she went through it like a champ, no issues. So anyway, so like I said, leave her in a position of all of our ending procedures. Make sure she's comfortable, has everything she needs, her call light, her bedside table is in reach of her, and then I would go and document my findings. And so documenting, I'm going to document the length, the width, the depth of the wound, the dressing, or the drainage, the taco, our taco of their drainage, our type, amount, color, odor of our drainage, and basically how the patient tolerated it. So that is it on sterile dressing change.